I'm an interventional radiologist and I do a procedure for fibroids. These are obviously conditions that affect women in the uterus that are treated by gynecologists in different ways. Interventional radiologists have a specific set of skills using catheters and wires under x-rays or other ways of visualizing without having to open a patient. So we can perform a treatment through a non-invasive interventional radiology technique for a gynecological problem. We work closely with gynecologists who are part of our team, and every patient is assessed by a gynecologist to address what the actual problem is and advise the patient on a treatment plan.
For the uterine artery embolization procedure, the downtime is really only 6 days. 1 to 2 days when you're in hospital, and then about 4 days after that where you're just on pain medication at home. But even though it's only 6 days, we are still going to book you off for 2 weeks so that you have enough time to fully recover and get more closer to feeling yourself. In terms of the fallopian tube recanalisation, that procedure is very, very quick. Our patients feel great. A lot of them don't even need pain medication after the procedure. You are in hospital for only 1 day. You actually go home that evening. And most patients are fine to go back to work after 2 to 3 days. If you're planning on falling pregnant in the future and you are currently symptomatic with fibroids, this procedure will actually improve your fertility. The amazing thing about this procedure is that it is not an operation. We are literally going to do the entire procedure through a drip in your wrist. And then through that drip, we're going to pass a catheter or a pipe. We then take that catheter up the arm, down the chest, and into the arteries that supply the uterus on the left and the right. And then once we're in those tiny arteries that are feeding the fibroids, we then inject these tiny particles. Those particles go in and then they block the blood supply to the fibroids. So now, because there's no blood getting to the fibroids, they actually shrink and they die and they don't cause problems anymore.
So the particles that we inject to block the arteries are made of a plastic PVA or a polymer, synthetic polymer, occasionally an animal protein. So these products are designed specifically to permanently block the arteries. They remain within the artery forever. The artery then creates a thrombus or a clot inside of it because these particles physically block the arteries. Now, they've been used for many, many years over many thousands of patients, so they are as safe as we can possibly make them.
The steps of the FTR process is very simple. The best part about it is that everything is going to be done in theatre. And in theatre, we're going to actually put the patient completely asleep, so you are not awake when we do the procedure. Once you are asleep, we then actually inject dye, so very similar to what was done in the HSG, your diagnostic procedure. We inject dye through the vagina, and then we get an idea of the uterine cavity. Once we can see the space of your uterus and where the tube should be, we then use a gentle wire. That wire then goes in and then opens the fallopian tubes on the left-hand side and on the right-hand side. And what we want to see is, after we've opened the tube, is that we then get dye that spills through on both sides. Then we know that your tubes are actually patent.
I'm based in Cape Town, but I offer the procedure in Johannesburg and in Cape Town. Because it's usually not an urgent procedure, it takes a few days or weeks for the patient to get all the details. We can create a procedure list. So I fly to Johannesburg or Cape Town depending on patient's demand. The waiting list is typically a few weeks. We'll have you in at a hospital, and 1 day in hospital is usually enough. After 1 week, you'll feel fine. After 2 weeks, you'll be back at work.